Working together in adult support and protection. Views and tools of people who access support. Easy read. Our report in just a few words. We are the Altram research team. Some of us also access services. Some of us work for the Thistle Foundation. Some of us work for Stirling University. Together we have done some research. Our research is about adult support and protection, or ASP for short. We wanted to know how people with support needs would like social workers to use this law when helping adults at risk. The law and the definition of an adult at risk have words that may be hard to understand. We have included a section to explain difficult words at the end of the report. The words we give an explanation for are in red. We showed the play to 4 groups in different parts of Scotland. 42 people told us what they would like social workers to do when helping a person. The person should get to decide what they share about themselves and their situation. The person should be asked, "Do you want an advocate?" This is a person who helps them understand what is going on. They also help the person get their points across. Maps, pictures, and any tool that helps the person communicate and keep track of meetings should be used. The person should get clear explanations and honest answers. Everybody should listen to the person. That is the most important thing. The people that came to the groups said there should be more work like this. People also said they would like to know more about social work. They would like to talk with social workers more often about how things should be done. Our main report. 1. In this section we talk more about what ASP is, how we did the research and what we found out. There is a section just about what it is like to do research on social work and what can make this easier and better in the future. 2. Some points may take a bit of thinking to understand. We hope you will talk about these with people who support you. We have included them because the people who took part in the research said they would like to decide for themselves if information is too difficult. They would not like people to decide this for them. 3. An adult at risk of harm is a person aged 16 or over who may be unable to protect themselves from someone harming them because of a disability, mental disorder, illness, physical or mental ill health. 4. This includes harm such as someone exploiting them or neglecting them. 5. The law and the definition of an adult at risk have words that may be hard to understand. We have included a section to explain difficult words at the end of the report. The words we give an explanation for are in red. 6. The law means that if a person who needs support is being harmed, the local council must look into this. They must work with the person so that they are protected. 7. They must do this in a way that respects the person's rights. 8. For more information on ASP, go to the Act Against Harm website, www.actagainstharm.org. Why we did the research. 9. There is not much information about what adults at risk want, so we decided to research this topic. 10. We want to let professionals know more about what people who access support think. We hope they will then know better how to help adults at risk. 11. Social workers are the professionals most involved in ASP. There are other professionals who can help too. It would be good if they also read our research. How we did the research. 12. Many people who have support from Altram organisations took part in the research. 10 people were on the research team. They helped plan, carry out, analyse and report the research. 13. We use stories and drama to help people discuss their thoughts and ideas. This is called forum theatre. 14. We found doing this was a very good way to learn more about how it would feel to be an adult at risk who is going through an ASP process. We found we had different views about issues that came up. 15. We made up a play about ASP. The play was about a man called James. James's sister thinks his friend Kate is stealing James's money. She thinks Kate is making him drink too much, but James says that Kate is a friend. A social worker visits to talk with James and his sister about these concerns. 16. We showed the play to 4 different groups of people who access support across Scotland. 17. With each group, we first used drama activities to get to know each other and build trust. 18. Then we showed the group the play we put together. 19. After they watched the play, those in the group gave advice that would make talking through concerns with James go better. 20. We then put together a play using people's advice to try out how things could go better. 21. This play showed what the beginning of an ASP process could be like. 22. With the group, we put together more plays that looked at how the later steps in the ASP process can work better. 23. At the end of our sessions, we checked to make sure we understood the advice people had given us. 24. We also thought about how we could tell social workers the advice people had given us. 25. By doing research, we found out some things about how people want social workers to help an adult at risk. We also found out some things about doing research together. How people would like a social worker to work with an adult at risk. 26. We found out that a lot of people have had bad experiences with social work. Often people felt the social worker did not get close enough to understand and help them. 27. Some people said social workers had helped them make important decisions. This had changed their life for the better. 28. People would like to introduce themselves to those helping them overcome harm and not be introduced by their file. They would like to talk about their goals, values and strengths. 29. Forms and reports can make a person feel bad and bring back bad memories. If a person is feeling low because they have been harmed, forms can be even harder to deal with. 30. People want honesty about choices, costs and decisions from social workers. Sometimes this means explaining things step by step. 31. The ASP process means the person will have to meet and learn how to work with people they don't know. This is easier if they have an advocate who works with them through the whole process. An advocate is someone who helps a person understand the process and helps them get their point across. 32. Sometimes information about the person may be shared between those working to help the person be safe. The reasons why the information needs to be shared should be explained to the person. 33. Meetings should be relaxed. They should use a person's strengths. There should be more thinking together and less presenting reports. 34. Making maps together that use pictures is a very good way to do planning together, both before and during formal meetings. This way the meeting and the plan are easier to follow. 35. Maps that show all the steps together can help the person understand how each step joins up to help them get to where they want to go. 36. Most importantly, people want to be listened to and supported to make their own decisions. 37. There were other things that we talked about that are difficult to put in words. It is important to point them out. 38. Being really listened to is hard to describe, but it is very important. 39. What makes a professional trustworthy is also hard to describe, but people feel they know it when they see it. 40. Resilience is a word social workers use to talk about how well someone copes and gets on with life. At first, many of us did not know what this word meant, but when we put our experience and ideas together, we found we knew a lot about it. Some of our thoughts about resilience are below. What resilience means to us. Going from darkness to light. You can take a hard knock and come back. Strength. Being creative. can cope with things. Choice, keeping your independence. Facing the sun, giving things a go even if it turns out a mess. Coming out from behind the clouds. Taking an opportunity. Evaluation. 41. We asked people what they thought of the sessions. This is sometimes called evaluation. 42. Everyone said they had fun. 43. Most people thought there was a good mix between what people who access support and paid staff did to run the sessions. 44. People felt they got their views across and were glad to be a part of something that was making things better for others. 45. Many people wanted more chances to be involved in research like this. What we learned about researching together. 46. Asking people to help with research can bring up bad memories. People may not feel comfortable. 47. People may feel a long way from where decisions are made and may not think their views make any difference. 48. People may be confused about how decisions are made or why services are the way they are. 49. Just researching people's views without also researching why the system is the way it is isn't the whole picture. 50. The system of research makes it difficult to do research that includes people with support needs. 51. There are barriers to talking with others who have support needs to gather their views. 52. There are fixed time limits and funding limits that mean people cannot take a break when they need to and come back to the work later. 53. It is hard to put yourself forward when you're used to being last. Research can feel like a race. 54. There are risks to saying what's happened if people who have power over a person's service provision don't like it. 55. Before you do research, you should think about what it's going to do to people. 56. But if research is exploring, you can't always know ahead of time what you're going to find or how you're going to grow. 57. Some people think that you have to be trained before you start being part of a research team. We found there is a lot you learn just by doing it. 58. Planning research together as a group is important. It has lots of different parts that have to fit together. We learned to be flexible. 59. It is important to prepare and know what each of us is doing. This is important even if we've done a piece of work before. 60. People have different needs and problems. It takes work to understand people and be understood by them. 61. We learn to listen better. This can mean waiting until the person has had their say. 62. When talking with social workers, we learn not to be afraid to ask questions. We learned how to ask better questions. They are human beings too. 63. Sometimes if you share a story, people will share a story back when they decide the time is right. This is better than asking people about their experiences. 64. Stories are a good way to help people talk about important issues together. We want to share our way of working with as many people as possible. 65. You can access videos which show how we did the research and the points people made at www.thistle.org.uk/risk research project/adult protection resources. Words that may need to be explained. Access. In this report, we talk about people who access services instead of service users. We say this because it makes people think about people's rights to access services and the barriers they often face to do this. Altrum. Altrum is a group of support providers that work towards creativity, community and citizenship for all. Analyse. To look at things carefully and decide what is important about them. Evaluation. To look at something to see how well it does what it is supposed to. Exploiting. Making a person do something that is not good for them. Exploring. Looking at something in different ways in order to learn new things about it. Flexible, able to change to make things work. Neglecting, not taking care of someone the way that they should be. Process. In this report, process means all the steps put together from beginning to end. Professional, someone who has training and skills to carry out an important job. Social work and social workers, work that is done to help people change their life for the better. This work is done if people are being harmed or living in a harmful situation. Social workers are people who do this work. System, all the parts that fit together to make something work the way it does. This includes rules, expected way of doing things, habits, and the roles people play